If you're older and still masturbating, I need you to hear this message. Because what most doctors won't tell you, what your family doesn't discuss, and what society has convinced you to feel ashamed about, might actually be the key to protecting your health, your vitality, and your dignity in ways you never imagined. My name is Dr. Mohit Kara, and I'm a board-certified urologist and men's health specialist with over 3 decades of experience working with aging patients. I've sat across from thousands of men and women in their 60s, 70s, and beyond, and I've witnessed something that breaks my heart. Too many older adults are abandoning their sexual health entirely, thinking it's the mature thing to do, the respectable choice, the natural progression of aging. But what they don't realize is that this decision is quietly destroying their bodies from the inside out. Today, I'm going to share with you the medical truth about masturbation in later life, not the myths, not the shame, not the whispered conversations, but the hard scientific evidence about what happens when you maintain this natural function versus what happens when you abandon it entirely. And I promise you, by the end of this message, you'll understand why this isn't just about pleasure or intimacy. It's about survival. Before we begin, if you're someone who values honest medical advice tailored specifically for older adults, go ahead and subscribe to this channel and turn on notifications. You'll never miss vital health information designed just for you. And if this message resonates with you, type 1 in the comments. If it doesn't, type 0 and let me know what you need to hear instead. Now let's start with something that might surprise you. The first and most crucial benefit of continuing masturbation in your later years. Something that could literally save your life. When I first started practicing urology over 30 years ago, I noticed a pattern that disturbed me deeply. Men in their 70s and 80s would come to my office, often accompanied by worried family members, complaining of urinary problems that had been building for months, sometimes years. Frequent urination, weak stream, painful pressure, sleepless nights running to the bathroom. The standard diagnosis was always the same: enlarged prostate, age-related decline, just part of getting older. But when I dug deeper, when I asked the uncomfortable questions that most doctors avoid, I discovered something remarkable. The men who maintained some form of sexual activity, even masturbation, even occasionally, had dramatically better prostate health than those who had given it up entirely. Here's what most people don't understand about your prostate. It's not just sitting there passively in your body. It's an active, living gland that produces fluid, and that fluid needs to move. When you ejaculate, whether through intercourse or masturbation, you're essentially flushing your prostate, clearing out old secretions, reducing inflammation, and maintaining healthy circulation to this vital organ. Think of it like this. If you had a water pipe in your house and you never used it, what would happen? The water would stagnate, debris would build up, and eventually that pipe would become clogged and dysfunctional. Your prostate works the same way. When you stop using it, when you abandon that natural flushing mechanism, problems begin to accumulate. I remember one patient, a 72-year-old retired teacher named Frank. He came to me after 2 years of worsening urinary symptoms. He was embarrassed, frustrated, and frankly scared. When I gently asked about his sexual activity, he looked away and said, "Doctor, I'm too old for that nonsense." But that part of his life was directly connected to his current suffering. His prostate was inflamed, enlarged, and causing him daily misery. When I explained the connection between sexual activity and prostate health, something clicked in his eyes. Not shame, but understanding. Research backs this up completely. Studies have shown that men who ejaculate regularly, even into their 70s and 80s, have significantly lower rates of prostate cancer. The Harvard Health Study followed over 30,000 men for decades and found that those who ejaculated 21 times or more per month had a 33% lower risk of prostate cancer compared to those who ejaculated less frequently. This isn't about being perverted or inappropriate. This is about using your body's natural mechanisms to protect your health. Your prostate doesn't care about your age, your relationship status, or what society thinks is appropriate. It only responds to function. And when you maintain that function, you're not just preventing discomfort, you're potentially saving your life. Masturbation in your later years affects something even more fundamental to your daily experience: your brain, your memory, your ability to think clearly and feel emotionally balanced. I want you to imagine for a moment that you're driving a car and slowly, almost imperceptibly, the windshield starts to fog up. At first, you can still see clearly, but gradually your vision becomes hazier, less sharp. You start making mistakes you wouldn't normally make. You feel less confident behind the wheel. That's exactly what happens to your brain when you abandon sexual activity entirely. Sexual arousal and orgasm create a powerful neurochemical response in your brain. Dopamine, serotonin, oxytocin, endorphins, all of these chemicals flood your system during masturbation. But these aren't just feel-good chemicals. They're essential for memory formation, emotional regulation, stress reduction, and cognitive function. I've seen this pattern repeatedly in my practice. Patients who maintain some form of sexual activity, even solo activity, report better mental clarity, improved mood, and sharper thinking compared to those who've given it up entirely. One woman in her 70s told me, "Doctor, I thought I was developing dementia." When we explored her history, I discovered she hadn't experienced any form of sexual release in over 3 years. Not because she was physically unable, but because she believed it was no longer appropriate for someone her age. When I gently encouraged her to reconnect with that part of herself, the change was remarkable. Within weeks, she reported feeling sharper, more engaged, more like herself again. The science behind this is fascinating. During orgasm, your brain releases BDNF, brain-derived neurotrophic factor, which actually helps grow new brain cells and strengthen existing neural connections. You're literally giving your brain a workout, keeping it young and resilient. But perhaps even more importantly, regular sexual activity helps regulate your stress hormones. Cortisol, the hormone released during chronic stress, is toxic to brain cells when it remains elevated. Sexual release naturally lowers cortisol levels, protecting your brain from this damage. This is why I tell my patients that masturbation isn't just about physical release. It's about maintaining cognitive health, emotional balance, and mental sharpness. It's about refusing to let your brain age prematurely, simply because society says you should be ashamed of your natural functions. And speaking of natural functions, the third benefit of maintaining masturbation in your later years might be the most immediately noticeable: better sleep, deeper rest, and the kind of rejuvenating slumber that can add years to your life. How many nights have you lain awake, staring at the ceiling, mind racing, body tense, unable to find that peaceful transition into sleep? If you're like most older adults, this scenario is all too familiar. But what if I told you that you already possess one of the most powerful natural sleep aids ever discovered? After orgasm, your body releases a cocktail of chemicals specifically designed to promote deep, restorative sleep. Prolactin levels surge, creating that drowsy, satisfied feeling. Oxytocin floods your system, reducing anxiety and promoting relaxation. Your heart rate slows, your breathing deepens, your muscles release tension. I've had patients who struggled with insomnia for years, trying every medication, every sleep technique, every remedy they could find. But when they rediscovered the simple act of sexual self-care, their sleep transformed almost immediately. One gentleman in his 80s came to me exhausted, frustrated, and frankly desperate. He'd been surviving on 3 or 4 hours of broken sleep per night for months. When I suggested that occasional masturbation might help, He was initially skeptical, but within 2 weeks of following my advice, he was sleeping 7 to 8 hours straight, waking up refreshed and energized for the first time in years. This isn't just about feeling rested. Quality sleep is essential for immune function, memory consolidation, tissue repair, and emotional regulation. When you improve your sleep through natural means, you're improving every aspect of your health. The fourth benefit might surprise you even more. Maintaining masturbation in your later years can actually strengthen your immune system and help your body fight off illness and disease. Research has shown that sexual activity, including masturbation, boosts levels of immunoglobulin A, an antibody that plays a crucial role in immune function. People who maintain regular sexual activity have stronger sexual health, tend to take better care of themselves overall. They exercise more, eat better, stay more socially connected. It's as if honoring this aspect of themselves gives them permission to invest in their total well-being. The fifth benefit touches on something that many older adults struggle with, but rarely discuss openly. Maintaining masturbation can significantly improve your mood and protect against depression. Depression in older adults is often overlooked, dismissed as a natural part of aging, or attributed to other factors. But I've seen how the complete absence of sexual activity can contribute to a profound sense of emptiness, disconnection, and emotional numbness. Sexual activity releases endorphins, your body's natural antidepressants. It provides a sense of pleasure, accomplishment, and self-connection that can be difficult to find elsewhere. When you abandon this entirely, you're removing one of your most accessible sources of joy and emotional release. One patient described it perfectly. She said, "Doctor, I felt like I was disappearing, not just from other people, but from myself." This isn't about being selfish or indulgent. It's about maintaining your emotional health and your sense of self-worth. It's about refusing to become invisible, even to yourself. The sixth benefit is particularly important for maintaining independence and dignity as you age. Regular masturbation helps maintain blood flow and nerve function in your genital area, preventing the kind of atrophy that can lead to pain, dysfunction, and loss of sensation. Use it or lose it isn't just a saying when it comes to sexual function. It's a biological reality. When you stop stimulating these areas entirely, blood flow decreases, nerve sensitivity diminishes, and tissues can actually shrink and lose elasticity. I've seen patients who thought they were being responsible by giving up sexual activity, only to discover later that they had lost the ability to experience pleasure even if they wanted to. This is particularly tragic because it's often preventable with consistent, gentle self-care. The seventh and perhaps most important benefit is the maintenance of your identity and sense of self. You are not just a body that's aging. You are a complete human being with physical, emotional, and spiritual needs that don't disappear with the passing years. When you maintain a healthy relationship with your sexuality, you're honoring all aspects of yourself. You're refusing to be defined solely by your age, your limitations, or society's expectations. You're declaring that you are still here, still vibrant, still deserving of pleasure and connection. I want to address something directly. Some of you watching this might feel uncomfortable, embarrassed, or even angry. You might think this advice is inappropriate, that someone your age shouldn't be thinking about these things. But I want you to consider this. Who benefits from your shame? Who profits from your disconnection from your own body? The truth is, ageism in our society often manifests as sexual shame. We're told that older adults should be asexual, that desire and pleasure are for the young. But this isn't based on medical science. It's based on prejudice and misunderstanding. Your body doesn't stop being your body when you reach a certain age. Your needs don't disappear. Your right to pleasure and self-care doesn't expire. And maintaining these aspects of yourself isn't selfish or inappropriate. It's necessary for your health and well-being. Now, I want to be clear about something important. I'm not suggesting that masturbation is mandatory or that there's anything wrong with you if you choose not to engage in it. What I'm saying is that this choice should be based on accurate information, not shame, fear, or societal pressure. If you're dealing with physical limitations, medications that affect sexual function, or other health concerns, there are often solutions and adaptations that can help. Don't suffer in silence. Talk to your doctor. Explore your options. You deserve to have access to all aspects of health and wellness. If you're struggling with guilt or shame about sexuality in later life, consider speaking with a counselor or therapist who specializes in older adult issues. These feelings are common, understandable, and treatable. As we conclude this discussion, I want you to understand that this isn't just about masturbation. It's about taking control of your health, refusing to be defined by limiting beliefs, and honoring every aspect of your humanity. Shame. If this message has resonated with you, if you've learned something valuable, please share it with others who might benefit. Like this video, leave a comment sharing your thoughts, and subscribe to this channel for more honest, science-based health information designed specifically for older adults. Remember, aging doesn't mean disappearing. It doesn't mean giving up on pleasure, connection, or self-care. It means adapting, learning, and continuing to honor the fullness of who you are. Take care of yourself. You deserve it. You've earned it. The truth is, what happens next depends on you. Are you going to let this information sit on the shelf? Or are you going to act on it? Because here's what I've learned from watching countless men transform their lives. Knowledge without action is just entertainment. Let me tell you about him to get through another day. He began viewing his body as something worth caring for, not something to endure. And yes, he maintained regular self-intimacy, but more importantly, he maintained his relationship with himself. This is what I want for every man watching this video. Not just the physical benefits we've discussed, though those are crucial. I want you to understand that taking care of your sexual health is taking care of your entire identity. It's about refusing to disappear, refusing to accept that your best years are behind you. The men who thrive in their later years aren't the ones who gave up on themselves. They're the ones who understood that self-care isn't selfish, it's essential. They're the ones who realized that maintaining their sexual health wasn't about reliving the past, it was about honoring the present. Care of your entire identity. It's about refusing to disappear, refusing to accept that your best years are behind you. The men who thrive in their later years aren't the ones who gave up on themselves. They're the ones who understood that self-care isn't selfish, it's essential. They're the ones who realized that maintaining their sexual health wasn't about reliving the past, it was about honoring the present. So let me ask you directly, what kind of man do you want to be? The one who lets shame and outdated beliefs slowly steal his vitality? Or the one who takes control of his health, his happiness, and his future? Because make no mistake, this is a choice, and it's a choice only you can make. The science is clear. The benefits are real. The risks of neglect are serious. But beyond all of that, there's something deeper at stake here. Your sense of self, your relationship with your own body, your belief that you deserve to feel good, to feel alive, to feel like the man you've always been. If you're ready to make that choice, if you're ready to prioritize your health without shame or apology, then start today. Not tomorrow, not next week, but today. Your body is waiting. Your future self is counting on you, and the man you're meant to be is still very much alive inside you. Because here's the final truth I want you to carry with you. It's never too late to come home to yourself. Never too late to feel strong. Never too late to choose vitality over resignation. You've lived too long and learned too much to give up on yourself now. Take care of yourself, not because you have to, but because you're worth it. You always have been, and you always will be. Robert, the patient I mentioned earlier. 3 months after our conversation, he came back to my office with a completely different energy. He wasn't talking about becoming 20 again. He was talking about feeling present, vital and confident in his own skin. Robert didn't just take my advice about maintaining sexual health. He built it into a complete approach to aging with dignity. He started each morning with intention, not just hope.